So his hip joint is made up of his femur, which runs from his knee up to where the ball of that femur hooks into a socket, sort of like this and like this, and that forms the hip joint itself, the socket. If you run your hand sort of up move your hand back and forth, you'll feel the bone is quite firm, hard. So that lets you know the bone. And right here where my index finger is, I'm pointing right over top of a little bone pointing straight up. That's the point of the femur. So deep inside there, almost going straight in, is this called the neck of the femur, and on the end of the neck is a little ball. And that forms the ball, which fits into the socket like this. So it's deep in, another inch or so deep from this point, further in, and that forms the hip joint itself. And because our dogs and our cats put so much force in their rear legs, it's a very common source of muscle pain and inflammation and injury. But what you need to do is, start out with, which is the basic techniques we talked about earlier. Just warm your dog, your cat's leg up first, slight extension and flexion, abduction and adduction, so moving it in and out, back and forth. You get a sense of where that joint is, you're just loosening up the muscle bellies, and then just some effleurage, going along the front of the hip, the back of the hip, down the front here. So we're going, imagine these big, which we have, these big quadricep muscles all along the front of the leg, down to the knee. Yeah, the big thigh muscles, over the big bum muscles, the gluteal muscles, along the back of the leg, the big thigh ones, the semimembranosus, semitendinosus. Then the inside, these big, the gracilis muscle, the inside of that hip joint that help move the hip in and out, the abductor, adductor muscles in here. So, so you're just doing some effleurage, a bit of compression. First, we're just warming up the muscle bellies, loosening them up in a real easy way. But in particular, areas to specifically focus on in terms of, when you've got a dog or a cat who's got something like hip dysplasia, they have a sore hip. Clearly they're going to secondary have muscles that are being compensated, they're moving more awkwardly, are going to be inflamed too. So what you want to do is then focus on where those muscle bellies attach. So you've got here, as you can see here, these big muscle belly, like Lewis's big quadricep muscles, and they're attaching right up here, right next to the point of that hip, the point of the femur. So you can put some circular motion with your thumb right around that area, right where some of those muscle bellies are attaching. If you feel a big knot, I want you to hold it for 10, 20, then 30 seconds, release. So you're putting pressure on those areas where some of the quadricep muscles attach, a common area for a muscle spasm. Good boy, Lewis. The next part is focusing the big back of the leg, the big semimembranosus and semitendinosus, these big thigh muscles, they're attaching up here to the back of Lewis's hip joint. So on the other side, right, they're going to attach to the side of his pelvis and along here, the top part of the femur. So once again, you're putting your thumb and forefinger, making some gentle circular motions around that area. Three or four more points, specific points. One, the GB34 point. So that's one that's just below the kneecap, and it's right next to that thing called the tibial crest, that's little bump. So it's the outside of the knee. You can palpate that in your own knee now, and you'll see me show you that in the video. Then there's a really key one, which is useful for multiple different points in terms of not just knee arthritis, but also for the immune system, also helping your dog's digestion in cases of bloat, called the ST36 point, and that's that's sort of one digit just lateral to that GB34 point. You'll see me show you that in the video. Then there's the BL60 and the KI3 points, and the BL60 is known as the aspirin joint. So watch that video and see where those points are all located. A couple of the key points that are in particular used even quite commonly with people. One is the GB34 point. So to find that, all I want you to do is run your hand down that knee, and you feel this big bump right below the kneecap, right there. That's called the tibial crest. And right beside that kneecap on the outside, there's an indentation there. That's the GB34 point. So I want you just to put moderate to firm pressure there. And it's a real key one for knee and knee arthritis. There it is there, Lewis. And just lateral to that, they say it's sort of 1 digit. It's called the measure. That's the measure Chinese medicine measures. It's called a Sun, C-U-N. And the length of one Lewis's digit is here. So it's about half of my baby finger. So one sort of half of my baby finger away. It's called 1 Sun. And it's right in here. It's in amongst where the tendons are running up, attaching up towards the knee itself. And that's called the ST36 point. It's a real key one, helpful for arthritis. Also thought to be helpful for dogs and cats that have stomach disorders. Been used to treat bloat. And you can feel this indentation in the muscle belly, and that lets you know that you're there. So what you've done is you found the tibial crest. Right beside there is the GB34 point, and sort of a half of a pinky length away in the muscle belly there, you feel this indentation in the muscle belly, as you can feel it right there. It's called the ST36 point, and we're holding that for 30 to 60 seconds. As I said, helpful for knee and knee arthritis, but also through, in particular, even stomach disorders. There you go, Lewis. And the last points that I want to show you for the back leg, and it's not just knee arthritis, but in particular the knees. And there's one I've called the aspirin joint, and it's found here in Lewis's hock, and this one's called the BL60 point, and then right in here, that's known as the aspirin joint. It seems to be more effective in people. So here's a big Achilles tendon, or the gastroc tendon, which is attaching from these big back muscle bellies here, attaching down onto Lewis's hock. So in between that and that bone, in between the tibia, there's this flap of skin here. So, and that's called the BL60 point. So you can put your index finger in there, and the other side of that, so you're just grabbing with your thumb on the other side of that, that's called the KI3 point, and that's considered a great one to help with normalizing energy flow. They say it's tonifying the chi. That is the energy source flowing through your dog and your cat's body. So you can hold those two in conjunction together. And it's a real good one where people, you've just got a sore dog and I want to do a fairly quick acupressure treatment. Just go ahead and grab that. And as you can see, as I do that, and just imagine, you can see Lewis just slowly relaxing. So that's the BL60 on the outside, the KI3 on the inside. I'm then holding that for 30 to 60 seconds.